Welcome to Close Up on America's Business, the program that takes you inside some of the most unique and successful companies in America. I'm Jim Masters. On each edition of our show, we introduce you to some of the most innovative business leaders in the country today. You'll discover what their products, services, technologies, and business models can do for you, what they're doing to change our world and change the way we do business.
When you find yourself in need of an oral surgeon, that's not usually a good thing. It means you're probably suffering from the pain of impacted wisdom teeth or some type of infection, or you've got a problem your regular dentist just can't solve. What is a good thing is finding an oral surgeon who has the skills and the technology to actually help you, and one who will do whatever they can to make the process as comfortable and painless as possible, which is why we thought you should meet the doctor we're visiting today. Hi, I'm Dennis Marie with Close Up on America's Business, and we're here at Mid-Manhattan Oral Surgery, the office of Dr. Paul Callett. He's a board-certified oral and maxillofacial surgeon with specialty training in dental implants. And he's got dentists and patients from all over the tri-state area recommending and referring people to him. Let's take a look.
An oral surgeon is a dentist, and it's a dentist that specializes in a very focused area of practice. Our training usually involves anywhere from 4 to 6 years of additional training, which is done in a hospital. It also involves intensive training and anesthesia, which allows us to put our patients to sleep if they choose that option. And I know a lot of patients are fearful, and that's one of the greatest things that we can offer someone, the ability to have their procedure as nervous and as anxious as they are while they're asleep. Our office is equipped almost like a hospital. You know, patient safety here is of our utmost concern, and it's something that we really take serious, me and my personally trained staff. In addition to our Midtown practice, we have a second location located in Hoboken, New Jersey, where we can provide the same level of care.
What are the types of problems or conditions that somebody might be experiencing that would have them need to come to you?
People come to us with a wide range of problems. I'd say the most popular is a patient coming to us in pain, whether it's related to a bad tooth or a wisdom tooth or missing teeth. Many patients also find us with TMJ problems, which can also relate to headaches. We can also perform orthognathic, or what some people call full reconstructive jaw surgery. As an oral surgeon, the term reconstruction can mean many things. It can simply mean replacing one tooth that's been missing for a few months or a few years, or replacing all of your teeth. And that's something that I've seen a lot throughout my career, and that's something that my specialized and focused training can really help someone. And this is something that we do on a daily basis, something that I'm personally very confident in. And these procedures can restore someone's appearance, bite, really allow them to proceed with life how they would like it to be.
I was referred to Dr. Callett by Dr. Spindell, who's a dentist here also, and I had impacted wisdom teeth that were getting a little bit infected and a little bit gross, and it was something that I wanted to do preemptively, and which is a big step, and so I came here, and the staff was wonderful. They put me at ease immediately, even though I was really worried about, taking such a big preemptive step. And no one really likes to get their wisdom teeth removed, but if you have to, then this is the right place to come.
Does a patient need to have a referral from their dentist in order to see you?
You don't need to be referred. When you come here, we'll diagnose and evaluate your problem, and if this is something that I can help you with, we're on top of it right away. Where if it's something that I think is better handled by a general dentist or a cosmetic dentist, then I'm oftentimes very happy to provide the proper recommendation and put you in the hands of someone that I personally trust.
He's just a person. He's not just a professional. He has very good bedside manners. He answered all my questions. He actually has a very good background. He has worked at several top hospitals in the city. And everyone here is really so nice. I would highly recommend him.
Putting a patient at ease has to be one of your number one priorities. So as someone who's in severe pain and I come to you, what's our first step?
Our goal during the consultation is to educate you, as well as to find out what your problem is and to see how we can best help you. And during that consultation process, there's a lot of exchange of trust, or we hope to gain your trust. And with that trust transference, I think we're going to help you overcome a lot of the trepidations and fears that you typically have about visiting someone new and visiting someone who has the word surgery in part of their profession.
You've recently added some state-of-the-art equipment to your office. Tell us what that is and how you can use that to provide better care to your patients.
The water-laced laser has really kind of changed how I practice. That allows me to, instead of cut tissue with a scalpel, it can be cut with light or water, and that's a lot less scary, oftentimes a lot less painful, provides for an easier recovery, decreases the chance of infection. You know, that's something that we can provide here that really sets us apart. We have a in-house dental CT scanner, which means that we can visualize your jaw structure in 3 dimensions. What that allows me to do is to visualize my surgery before even treating the patient. I can plan the patient's surgery with them standing next to me as compared to being in the dental chair and being asleep.
I come from Woodstock, New York, and that's a statement within itself because it's a 3-hour trip to come to Dr. Callett's office and a 3-hour trip back. So that's 6 hours and I can actually be in London. And there's a lot of dentists between Woodstock, New York and 41st Street. However, I take the time to travel to Dr. Callett because of the service and professionalism I get in this office. Needless to say, Dr. Callett did an incredible job. He's a skilled person, knowledgeable. He has great bedside manner. His staff is excellent. So you have professionalism that is focused on customer satisfaction. So far, the tooth has given me no problems, and I am one satisfied customer who discriminates. And when there's a job done well, I always compliment it. And I can't say enough about Dr. Callett on his focus on doing the right job and in customer satisfaction. And I came all the way from Woodstock, New York to say this, even though I'm going on holiday tomorrow.
Where are you going tomorrow?
South Beach.
Right on. Right on.
I'm here to really convey to someone a certain level of confidence that your problem, yes, your problem is unique, but we've seen these problems so many times before, and we've helped hundreds, if not thousands of people over the years just return to a normal smile and to really have no regrets that you finally made the decision to move forward and help yourself achieve better dental health.
We all know that oral health is important to our overall health. So if you want your mouth to feel good and look good, call Dr. Callett. Reporting for Close Upon America's Business, I'm Janice Marie.